Many people assume that research and quality improvement are not natural bedfellows, but actually, if you really want to improve quality of care, then you need to bring the best of what you have from research and quality improvement together. And there are lots of ways that we can think about how to do that. So research is really about trying to understand what might work in a given context. So it's trying to really study and test hypotheses about what kind of treatment or what kind of service model is most efficacious in a particular circumstance. Improvement is about taking what we know from our own experience or from the evidence base we think might work and then testing it out in real life and making adaptations so that we can really embed that into day-to-day practice. So what you want to try to do with your quality improvement work is to access the knowledge that we have from research about what works. So scan the literature and find ideas that we know from trials and evidence work in a given condition or a given context, and then use that knowledge to inform your change theory in quality improvement and test those ideas out. Now, some of those ideas may work exactly how they worked within the research trial, but some may need some adaptation to our local context and the local needs here. So that's why you need both research and quality improvement. An example of this, very simply, one that we've used over the last few years, we've been trying to work on reducing non-attendance at appointments. We had about 25% of people not attending their appointments in our community teams. So we looked at the research to see what had been shown to work. We found that text messages were a highly efficacious way to encourage people to come along to their appointments. They engaged people and reminded them about when their appointment was. But there was also a large randomized controlled trial carried out to look at the different kinds of wording in a text message to see which was most likely to result in people coming to their appointments. So we used the learning from that randomized controlled trial to inform the words that we tested here at East London Foundation Trust in the text messages we were sending to service users to encourage them to come along to their appointments. So that's an example of how you can build in research knowledge into your quality improvement work. At the other end, you can use the learning from quality improvement to inform research. So there are many places and areas of our improvement work where there isn't a great evidence base. One example of this is our work to reduce inpatient physical violence, where if you look at the literature, there are only a few case studies and case series. There aren't really very good research studies done yet. And yet what we found here at ELFT is that by using a combination of ideas, we can actually predict and prevent physical violence on our inpatient mental health wards. And that is now going to go forward as a large research trial so we can actually demonstrate cause and effect. In improvement work, because you're working in real life conditions, you can't be absolutely sure that one thing has caused some results to happen. You can have theories and you can have increasing degrees of belief, but you can never demonstrate causality because you'd have to get rid of every other potential confounder or factor that may influence the outcome. So we're going to take those 4 change ideas that we've been testing and scaling across the organization and put them into a large-scale research study where we're now going to look to see whether there is any effect of those 4 factors on the outcome of physical violence when we remove all other potential sources of confounding or bias. So, in conclusion, there's lots of ways that you can use the findings and learning from research to inform our quality improvement work. In fact, we should be, because there's knowledge out there that can really help us tackle some of the problems we're solving through quality improvement. But we can also use the findings from quality improvement to inform future research work.